My name is Cameron, and today I'm going to be demonstrating how to perform a sinus and mandible series. I've got my tube here detinted to the wall bucky. It's going to be 40-inch SID. We're going to be using the upright bucky. I've got a chair here ready for my patient. We're going to be doing 8 total images, so I'm going to have them seating. It's going to take a little while. I'm going to be using an 8x10 cassette. You want to use the smallest cassette possible. I've got my shield here ready to go. Thyroid shield. And we're going to go ahead and wipe down the bucky as well, because the patient's going to be placing their face against it. And besides that, I'm ready to get my patient. Alright, now that I've set up the room, it's all ready to go. I'm going to go ahead and get my patient now. Hello.
Hi.
Is Evelyn?
Yes.
Hi, can you confirm your last name and your date of birth for me?
Yeah, Malero in August 19th, 1987.
Okay, perfect. My name is Cameron. I'm going to be doing some x-rays today. Can you tell me what brings you into the hospital?
Yeah, I've been experiencing some sinus pressure. Also, I had an accident, fell and hit my face, and so my jaw is bothering me now.
Okay, alright. Well, that looks like you're going to be doing some sinus x-rays as well as the mandible. So you
Okay.
said your pain?
Yeah.
Okay. Alright, go ahead and get the shield on here. And before we start, is there any chance you could be pregnant?
No.
No? Okay, great. Go ahead and place the thyroid shield on backwards since we're going to be starting with the PA projection. Perfect. So go ahead and take a seat. I'm going to be using a horizontal beam for these because we're looking at the air fluid levels in the sinuses and we don't want them to be distorted. So, for this one, we're going to have the mid-sagittal plane perpendicular. So we're going to have her scoot a little bit closer to the bucky. We don't want too much of OID. Go ahead and place your face close to the board as you can get. And we want the OML to form a 15-degree angle to the central ray. So we're going to have her tilt her head back a little bit. Right about there, that's perfect. And the central ray exits the nasion. So, get a position for that. There. You'd also ask to make sure the patient's not wearing any facial jewelry, no pins in their hair or anything. Got my 8x10 cassette in here, so I'm going to collimate down to that. Up there. I'm also going to make sure my bucky is lined up. I'm going to mark the anatomical side. That. Perfect. Okay. For this one, I'm going to shoot it at about 70, 75 at about 8 mass. Alright, Evelyn, go ahead and hold your breath. Don't move. Expose. Alright, go ahead and breathe. Okay, now that I've performed my PA axial projection, we're going to move on to the water's view. So I'm going to have her put her face up against the IR again, tilt the head back. You want the OML to form a 37-degree angle to the IR. This puts the MML, the mentomeatal line, pretty much perpendicular to the IR, which we are pretty good right now where we're at. The central ray for this one exits at the acanthion, one of the mid-sagittal plane perpendicular to the IR, of course. So, we're pretty much lined up right here. I have my marker on the right side. Collimate down. Actually, move you a little bit to your right. Right there. Perfect. My bucky's lined up. For this one, I'm going to shoot about the same technique. About 75 at 8 to 10 mass. Alright, Evelyn, go ahead and hold your breath. Don't move. Expose. Alright, you go ahead, you can breathe. I can set out and run it. Move on to the next one. Alright, I'm ready to shoot my next image now. We're going to do the lateral. So, we're going to have her turn a little bit into an LAO position. I'm going to have you scoot forward a little bit. Place the left side of your face up against the board. Just like that. On this one, we're going to have the mid-sagittal plane parallel to the IR, and the interpupillary line is going to be perpendicular to the IR. Central ray is horizontal still, it is for all the projections, and we're going to be using an 8x10. And it's going to enter about a ½ inch to an inch posterior to the outer canthus. So that's going to be about right there. Maybe just lean back a little bit, right about there. Perfect. So this one, since her left side is the side that's bothering her, it's up against the board. I'm going to place my left marker. Collimate down. About there. For this one, I'm going to use a technique of about 75 at, probably keep the same technique, about 75 at 8 to 10 mass. Alright, Evelyn, go ahead and hold your breath and don't move. Expose. Okay, go ahead and breathe. Move on to the next image. Alright, and the next view we're going to do is the SMV. We're actually going to have her stand up now. It's going to be kind of an AP projection. So what we're going to do is remove the shielding, move it around to the front. For this one, the mid-sagittal plane is going to be perpendicular to the IR again. And we're going to rotate the chair around. Okay, Evelyn, go ahead and take a seat there. Sit towards kind of the edge of the seat, that way you kind of lean back. This one's going to be a little uncomfortable to do, so go ahead and lean against the back of the chair. And then put your head back so that the top of your head is up against the board. You need to scoot the chair back a little bit, you can. Okay. So for this one, the central ray is going to be horizontal again, and it's going to enter 3/4 of an inch anterior to the EAM. Have you actually scoot this way a little bit, towards me a little bit. Put your head back. That's better. Okay. So head back, top of the head up against the cassette. I'm going to line up here. It's going to enter between the gonians. Be right about there. Adjust my butty. About there. I'm going to mark her left side. Just rotate your head a little bit this way. Perfect. Right there. Collimate it down. Okay, for this one again, about 70 to 75 kV at about 8 to 10 mass. Alright, Evelyn, go ahead and hold your breath, don't move. Expose. Alright, go ahead and breathe, you can relax. How are you feeling?
Wonderful.
Alright, great. From here we're going to move on to the now. Okay, now that we're done with the sinus series, I want to mention you would want to use a cone if you have one. We don't have one available to us, but it improves the quality of the image. So now we're going to move on to the mandible. We're going to be doing a PA axial to start. So we've turned the patient around, we've placed the shield back so that it's on her back. I've removed the thyroid shield because it's going to get in the way of the mandible. Put on a 20 to 25 degree cephalic angle on the tube. You want the mid-sagittal plane and the OML perpendicular to the IR. So go ahead and what you want to do is have the patient rest their forehead and their nose on the IR. That places the OML perpendicular. And the central ray is going to enter, or it's going to exit the acanthion. So, right about here. Make sure we're centered. Move to your left a little bit. Right there. Perfect. Okay. Place my right marker. I'm going to collimate down a little bit. We want to get just the mandible in there. Okay, on this one, I'm probably going to shoot a technique of about 75 kV at about 12 mass. Okay, Evelyn, go ahead and hold your breath. Don't move. Expose. Okay, go ahead and breathe. Alright, now to continue the mandible series, we're going to do 3 oblique images. We're going to have the patient turn into an LAO position so that the head is in a true lateral again. So scoot a little bit closer to the bucky for me. Place the left side of your face up against the IR. Here we're going to have the central ray entering the mandibular region right about at the gonians. gonna tube up. We're gonna have a 25-degree cephalic angle for all three of these. I'm gonna adjust the bucket. Use my left marker. I want the mid-sagittal plane to be parallel with the IR and the interpupillary line perpendicular. And you want the patient to extend their chin out so that the long axis of the mandible is parallel with the transverse axis of the bucky. So right about there. Actually, lean back for me just slightly. Right there. Perfect. And the cone down. And drop the technique a little bit. I'm going to probably use about 75 at about 10, 8 to 10 mass again. Okay, Evelyn, go ahead and hold your breath and don't move. Expose. Alright, go ahead and breathe. Move my cassette, run it, bring in another one. Now we're going to do the, that was for the ramus of the mandible. Now we're going to do the body. So everything stays the same, angle of the tube and everything. We're just going to rotate the patient's head in 30 degrees. So go ahead and turn your head towards the bucky, a little bit more, right about there. Central ray still enters the same place. Yeah, that looks good. That's keep the marker, come down, same technique. Go ahead and hold your breath, don't move, expose. Go ahead and breathe, run my cassette, bring in another one. Now we're going to do the symphysis. So that's just another rotating the head 15 more degrees, so we're at a total of 45 degrees now. So rotate the head inward a little bit more, a little bit more. That's good. Enters the same place, and towards your left a little bit, right there. Cone down a little bit more. There. Same technique. Evelyn, hold your breath, don't move. Expose. Go ahead and breathe. Got my cassette and run it, and that is the mandible series. Alright, first image we have here is the PA axial of the sinuses. Here, if we had the collimation opened up, we would be looking for an equal distance on the lateral borders of the skull. You also want to see the petrous ridges in the lower 1/3 of the orbit. You want to be able to see the frontal sinus as well as the ethmoidal sinus, the ethmoidal air cells. And here we have the parieto-acanthial projection, the Waters method. In this projection, you're primarily looking at the maxillary sinus, but you can also see the frontal sinus here as well. You want to make sure there's no rotation by looking at the orbits and the maxillary sinuses, making sure they're symmetrical on each side. You want to see the maxillary sinuses here, obviously. You want to see the petrous pyramids lying immediately below the floor of the maxillary sinus. Alright, in this image here, we have the lateral projection of the sinuses. In this one, you're really looking for all 4 sinuses, but the sphenoidal sinus is of primary importance, and you want to look for no rotation by looking at the sella turcica here, as well as the mandibular rami being superimposed, as well as the orbital roofs being superimposed. Alright, and here we have everyone's favorite, the SMV projection of the sinuses, the subminto vertical projection. And this one, you want to make sure that there's equal distance from the lateral border of the skull to the mandibular condyles, and you want to see the mandibular condyles to be anterior to the petrous pyramids, and you're also looking for the anterior frontal bone superimposed by the mental protuberance. This indicates that the patient was positioned so that the IOML was parallel to the IR. Alright, moving on to the mandible. First one we have here is the PA axial. In this one you're looking at the body as well as the rami. Here you want to see, again, good evidence of proper collimation. You want to see the mandibular body and the rami symmetrical on both sides. You want to definitely be able to see the condylar processes as well as the entire mandible. Now we're going to take a look at the axiolateral obliques of the mandible. In each of these, you're really looking at the anatomy that was most parallel with the IR. In this case, the first one we have here is the axiolateral oblique of the ramus. You want to make sure that you have no elongation or foreshortening of the ramus, and because we used a 25-degree cephalic angle for all of the images, this ensures that there will be no overlap of the ramus on the opposite side of the mandible. And here we're looking at the axiolateral oblique of the mandibular body. Here we're looking at the body of the mandible, as the name would suggest. And you're looking for no rotation, and it's very similar to the last image. We just rotated the patient inwards a little bit. One thing I should mention, you also want to make sure that there's no superimposition of the cervical spine with the mandible. And lastly here we have the axiolateral oblique projection of the symphysis, the mental point of the mandible. Again, we're looking for no superimposition of the cervical spine and the symphysis. Also, we want to make sure there's no foreshortening or elongation, and no overlap of the opposite side of the mandible.